Flat epithelial atypia is a lesion that has been concerning for a lot of people because it has the word atypia in it, but recent research has shown that women who have flat epithelial atypia do not have a dramatically increased risk as long as they do not have one of the other high-risk lesions also present. But in about a quarter to a half of women who have flat epithelial atypia, they may have one of these other high-risk lesions, either atypical hyperplasia or lobular carcinoma in situ. But if they have only flat epithelial atypia, they do not have a significantly increased risk of breast cancer, and they can be managed just as, most women of average risk. If a woman has atypical hyperplasia, then we know that her long-term risk of a breast cancer is increased. And again, that estimate would be about 1% per year. And she should be advised about what that risk is, as well as the fact that there are several things that can be done. One would be surveillance, just to look for breast cancer if it is going to happen, to try to detect it at an early stage. And that may consist of mammograms, which would be recommended for all women, but it may also add in some additional supplemental type of screening. Sometimes that is breast MRI, sometimes that is ultrasound, and there are other research trials looking at what types of additional imaging would be good for detecting breast cancer. Another option for a woman who has atypical hyperplasia would be a prevention medication, and there are several types of those medications that work well. All of them reduce breast cancer risk by about 50%, maybe even a little more than that in women who have atypical hyperplasia. And in some unusual cases where there is a lot of atypical hyperplasia, we might even consider doing risk reduction mastectomy to maximally reduce someone's risk. But that is something that is not routinely recommended, and we really reserve for more severe cases. For women who have lobular carcinoma in situ, really their management is very similar to women who have atypical hyperplasia, except that their risk is higher in general, and so how they make decisions about what they might want to do for frequency of screening, intensity of screening, whether or not they choose to take a prevention medication, or whether or not they might choose to do mastectomy, those decisions will probably be influenced by how high their risk is. But there's no right or wrong choice in managing risk. It's really just a discussion between the provider and the patient to understand what their risk is and understand the options for managing that risk and figuring out what is the best fit for that patient.